Hello FMG, today we are going to see biochemistry one-liners. In starvation, there is an increase in pyruvate kinase. Musty odor urine is seen in phenylketonuria. Vitamin necessary for post-transcriptional modification is vitamin K. Decarboxylation needs vitamin B6. Powerhouse of the cell is called mitochondria. Protein synthesis takes place in endoplasmic reticulum. Daily secretion of bile by liver is amount of 500 to 1000 ml. Hemorrhagic disease of newborn is seen in due to the deficiency of vitamin K. Acrodermatitis enteropathica is due to zinc deficiency. Molybdenum is necessary for xanthine oxidase. Huntington disease is due to deficiency of tryptophan. Alkaptonuria is due to deficiency of homogenistic acid oxidase. In alkaptonuria, the deposition of substance is called homocysteine. Vitamin used to correct neurological symptom is cyanocobalamin B12. Wernicke-Korsakoff psychosis or beriberi cause deficiency of thiamine B1. Pellagra is caused by deficiency of niacin B3. Burning foot syndrome is caused by deficiency of pantothenic. Megaloblastic anemia or neurotubal defect caused by deficiency of folic acid. Pernicious anemia caused by deficiency of B12. Seborrheic dermatitis caused by deficiency of riboflavin B2. IHT is associated with which type of cholesterol is LDL. Seen in chronic starvation, insulin decreases, glycogen and growth hormone increases, free fatty acid increases and glucose tolerance decreases. Southern Bolt test is used to detect DNA. Northern Bolt test is detect RNA. Western Bolt test is used to protein. Respiratory distress syndrome in premature infants is due to inadequate secretion of dipalmitoyl phosphatide clonine, part of surfactant, index of lung maturity and less than 2 indicates IRDS. Vitamin used for inhibiting lactation is B6. Wernicke's encephalopathy is caused by deficiency of B1. Vitamin K dependent clothing factors are factor number 2, 7, 9 and 10. Enzyme deficient in Marfan syndrome is lysyl oxidase. Reaction takes place in mitochondria in Krebs cycle, urea cycle, electron transfers and fatty acid cycle. Melatonin is synthesized from tryptophan. Amino acids are excreted in urine in cytonesis, cysteine, orthonine, arginine, lysine. In maple syrup's urine disease, the amino acids excreted in urine are leucine, isoleucine, valine. Sulfur-containing amino acids are cysteine and methionine. Conjugated hyperbilirubinemia is seen in Dubin-Johnson syndrome. In a Hampton disease, excreted in urine is tryptophan. Bile contains cholic acid, oxocholic and deoxocholic lithocholic acids. Co-effector for transmission is pyridoxine. Vitamin essential for transamination is B6. Phenylpyruvic acid is the urine is detected by gluten stress. In alkaptonuria, the urine contains hemogenistic acid. Insulin has 51 amino acids. Von Glick's disease is due to deficiency of galactose 1-phosphate uridyl transferase. Essential fatty acids are linoleic or arachidonic acid. Iron is absorbed actively in duodenum. Vitamin B12 is absorbed in terminal ileum. Cardiac enzymes are CPK, LDH, SGOT. Amount of proteins excreted in urine is 24 hours is less than 150 mg. Highest content of triglyceride is seen in kilomicrons. Atherosclerosis is due to apoprotein E deficiency. Triglyceride synthesis is increased by insulin, which is an essential amino acid is phenylalanine, lysine, leucine. Insulin act on which enzyme is glycolysis is glycokinase. Present in cerboside is sphingosine, galactose. Melatonin is derived from tryptophan. Liver products albumin, fibrinogen, prothrombin, not gamma globin. Bile acids are formed from cholesterol. Heme is hemoglobin in hydrophobic pocket. 17 alpha hydroxylase deficiency cause decreased testosterone. Substance that does not cross blood-brain barrier is insulin. Anti-infective vitamin is vitamin A1. Tissue is IS glycogen contact liver. Detoxification of drug is controlled by cytochrome P450. Anti-atherosclerosis lipoprotein is HDL. Most common enzyme deficiencies man is glucose 6-phosphate dehydrogenase. Largest amount of prostaglandins are seen in seminal fluids. Sulfonamines are conjugated by glucuronic acid. Which amino acid causes hypoglycemic is lysine. Vitamin present in coenzyme A is pantothenic acid. Insulin resistance is seen in hypothyroidism, acromegaly. Fatty acid not synthesized in the body is linoleic acid. Albinism is result from the deficiency of tyrosine. Enzyme stored in muscle is CPK. Secondary hyperparathyroidism is caused by CRF. Abnormal urinary constitutions are albumin, ketone, glucose. Urinary constitution is amino acid, urea, creatine. Polyuria is seen in diabetic mellitus and diabetic insipidus, recovery from acute nephritis. Polypeptide hormones are seen in insulin, angiotensin, growth hormones. Physiological constituents of urine is urea and creatinine. Major side of action of insulin is muscle, adipose tissue, liver. Semi-essential amino acids are arginine, histidine. Ratio of adrenaline to noradrenaline is 85 to 15. And examples of monounsaturated fatty acids are olenic acid. Acidic amino acids are asparagine, glutamate. Basic amino acids are arginine, lysine. Aromatic amino acids are tryptophan, triosine and phenylalanine. Total body of iodine stores are about 50 mg. Vitamin C is present in the largest amount in the body's adrenal cortex. Tetany can be caused by hypocalcemia, hypomagnesemia. Zerboside contains which of the following is sphingosine? Ketone bodies are acetoacetate. Bile acids are derived from cholesterol, which is completely dependent on glucose as fuel. Retina. Immediate precursor of norepinephrine is dopamine. Uric acid level has increased in pre-eclampsia, Hodgkin's lymphoma, and leukemia. Metal in vitamin B12 is cobalt. Ammonia in the brain is converted into glutamine. Dopamine synthesis in brain increased by carbidopa. Calcium binding protein is troponin C. Metabolic of epinephrine is epinephrine. End product of urine metabolism is uric acid. Vitamin A overdose causes injury to lysosome. Myocardium normally utilizes fatty acid. Maximum amount of serum cholesterol is found in LDL. Vitamin that is useful in cancer in vitamin A. Enzyme acetylcholine esterase synthesis is liver. Urea in the brain is derived from glutamine. Non-essential amino acids is tyrosine. Enzyme primarily responsible for protein degradation is stomachase pepsin. Increased anion gap is seen in renal failure, lactic acidosis, DKA. Cholesterol from liver is transported to the tissues mainly by the VLDL. Precious of steroid cholesterol. Maple syrup urine disease is due to deficiency of decarboxylation. Amino acid that can be converted into vitamin is tryptophan. Main function of mitochondria is electron transfer. Histamine is produced by decarboxylation. Glutathione is a tripeptide. Ketone body formation take place in liver. Xanthuronic acid is product of metabolism of tryptophan. Neurotransmitter is glutamine. DNA is double helix is bounded by hydrogen bond. Glucose 6-phosphate dehydrogen deficiency is seen in workers' disease, which is not seen in starvation is hypocholesteremia. Muscle glycogen is mainly utilized from supplying energy to heart. Enzyme marker of the electron transport system is cytochrome reductase. Major contribution towards glyconeogenesis is by alanine. Conversion of prothrombin, the thrombin requires factors of 7, 10, 5 and calcium, which does not inhibit platelet aggregation is thromboxane A2. Conversion of proline to hydroxyproline is by vitamin C mediated hydroxylation. Keto bodies which maximum is DK. Diabetic ketoacidosis, acetic acid. Biotin is essential for carboxylation. Ketoacidosis without glycosuria is seen in prolonged starvation. Protein synthesis takes place in endoplasmic reticulum. NADPH is required in lipogenosis. Dietary fiber is rich in pectin. Lipid which accumulates in fatty livers is triglyceride. Glyconeogenesis occurs in liver and kidney, which has the highest cholesterol content is LDL. Gem oil is then high content of vitamin E. Melanin is synthesized from phenylalanine. Obesity is associated with decreased insulin response. Glycerol is converted in glucose in liver. Vitamin K plays an essential role in biosynthesis of prothrombin and proconvertin. Preservation used in urine samples for chemical analysis is thymol. Heart muscles in compression of skeleton muscles as high carnosine. Oil rich in linoleic acid is sunflower oil. pH of normal sweat is 4.5. Urea is mainly formed in liver to small extent in brain. Panthenolic acid acts as CoA. Fluoride ion act by inhibiting enolase. Protective factor for heart high HDL. Deficiency of vitamin is not known in newborn is E. Taudored skin is seen in deficiency of vitamin A. Resting membrane potential is close to isoelectric potential of chloride. Infant gastric juice is pH is 5.0. Enzyme diagnostic of MI in a case of hypothyroidism is CPK myoglobin. Transaminase enzyme is the most abundant in heart. White hair is due to deficiency of melanin. Tyrosine is an oxidase. Anticoagulant is used for preserving blood for PT. Estimation is sodium citrate. Chemically steroids derived from pyrrhohydrocyclone.